All right, the next one is going to be blood pressure, and that's on 84 in your book. So blood pressure are two numbers, a top number and a bottom number. Our top number is referred to as systolic. Our bottom number is referred to as diastolic. Okay? If you ever have trouble remembering it, I just remember D for down means it's the bottom number. So systole or systolic represents the amount of pressure exerted on the wall of the artery during the contraction phase of the heart. So when my heart is squeezing, contracting, I'm going to have a higher number because the blood's coming out of the heart. And then when it's relaxing or refilling, that's diastole or diastolic. And so again, I get a 2-number reading with that. Like all of our vital signs, there are ranges. So systolic or systole typically ranges from 100 to 140. And diastolic or diastole usually represents from 60 to 90. So again, if any of you have ever had blood pressure or had a family member being monitored for blood pressure, they are looking for a diastolic reading that consistently exceeds 90. I'm not as worried about the top number. That really isn't a misnomer. I'm very worried about the bottom number because if my heart is not relaxing when it is recovering, refilling, repolarizing, if that's a high pressure, then it's ultimately going to create damage on the heart. Kind of goes back to the work of the heart muscle, that I can damage it as a result of ongoing hypertension that's not treated. If this number drops below 100/60, we're going to call it hypo for the prefix, tension for the root word, and if it's elevated, we're going to call it hypertension. Okay, and again, like our other vital signs thus far, there are causes. Now, we come back to here. When you're dying, your blood pressure is dropping. Certain medications, and again, it still may be the desired effect or the side effect, but more often than not, this is a side effect because the desired effect to blood pressure medicine isn't to bring it below this, it's to keep it within normal range. So this is usually a side effect. So again, certain medications, some of them are heart medications, some of them are pain medications, sedatives, benzodiazepines, those types of things can create hypotension. Okay? Volume loss. Same thing, if I am hemorrhaging, if I'm bleeding, if I have vomiting, if I have diarrhea, and there's volume loss in the container, my pressure is going to drop. Now I'm going to give you kind of a crude analogy, but it'll kind of have an understanding of what happens. So if we took a break and you went to the bathroom, and one of you decided that, oh goodness, I got to go to the bathroom and I got to have a BM. And so you're in the bathroom, and so likelihood, particularly being here in the building and got other classmates that may go in that bathroom in a few minutes, you're likely going to stay in there and flush and make sure that everything goes away, right? I mean, that's just human nature. And so you'll flush, and you may pay attention for a few minutes to things going down the bowl. And if you don't think it's going fast enough, or you're concerned about it going down, what do we, by nature, tend to do? Try to flush again. We grab that handle and we go, right? And what does the handle feel like? It's loose, isn't it? It's just floppy. It's like it's not making it flush again. Because what I did is I reduced the volume in the container. And when I reduce the volume in the container, I am not going to restore normal function until I refill the container. So you're going to get that container filling back up after you've flushed it, and the tank's going to begin to fill back up, and finally that loose handle is going to get firm again, right? And you could flush again. Now, that's kind of crude, but it's the same idea. If I have a container of blood volume fluid and I lose it, my heart cannot maintain pressure in the container. And the only way I'm going to restore pressure, which restores function, perfusion in this case, or flushing, I've got to restore the volume in the container, just like I have to let that tank fill back up. So just think about it on those lines. So volume loss is a biggie. Now, hypertension, the reason this is concerning is those are some of the top reasons people have hypertension. The aging population, can't change that. Your ethnicity, can't change that. Your gender, you can surgically change it, but you can't genetically change it. Your genetics, your family history, is your family history of hypertension. So you could have hypertension and you could be very healthy because of one of these. I know we're hearing in the news right now with this COVID. What population of people are they saying are getting hit the hardest with COVID? Who remembers in the news? African American and Latino, of course elderly, but Latino and African American, right? They're trying to figure that out. Well, guess what happens in hypertension? The same things here. The highest population of people with hypertension are African American men. Don't have a good answer for you why. They've studied that for a long time. But go into a dialysis unit and watch the men that are on dialysis. It's almost all men, and many of them are African American. So there's so many things we can't control that the things we can control, we need to do our best. Diet, weight, exercise. And I am not a good example of any of those, but it's the reality that if we really want to offset some things I may not be able to control, I need to kind of monitor how I'm eating, how much I'm eating, my overall body mass or body weight or body index, and am I at least trying to exert myself with some level of activity. That doesn't mean getting on a treadmill or elliptical for hours, just exerting yourself in some level. We've heard for many years that walking is enough. So again, from a written test perspective, you could be given a scenario question. You checked your patient's blood pressure, and the blood pressure is 136/96. This would indicate that systolic was normal, diastolic was normal, systolic was normal, diastolic was high, systolic was abnormal, diastolic. So again, you'd have to kind of have an understanding of this range. That could be a written question. And then on the practical, you could actually draw the skill of doing blood pressure. Okay. So again, I'm going to get the blood pressure machine out, and we're going to do that in just a few minutes. So what I want to do, I'm going to stop the video for a second. We're going to do 2 activities, but I'm going to give you a break because we